Hi, I'm Nora, and today I'm going to talk about some of the work that I've been doing for my PhD on patient-specific phantoms for minimally invasive surgeries. And the phantoms that I'm going to talk about today are for neurosurgical applications. As I'm sure you're all very aware, phantoms are vital tools for many applications in biomedical engineering, including the calibration and evaluation of different imaging systems, and for testing and developing novel devices. Clinically, phantoms are also important as training tools and for patient-specific surgical planning. However, the phantoms that are available for these applications often have limitations associated with them. For example, phantoms that are relatively affordable and simple to fabricate often don't have the required level of anatomical realism. And phantoms that are more complex and realistic are usually the commercially available phantoms, which are very expensive. And phantoms also might not be made of materials that are compatible with certain imaging modalities. Silicone is often used, and that's not really compatible with ultrasound. So in my work, I've tried to kind of overcome some of these challenges and create phantoms that are anatomically realistic because they're based on real patient data, and they are compatible across multiple imaging modalities, and also they are relatively affordable and simple to fabricate. So for some of my work, I collaborated with Dr. Jonathan Shapey, who is a neurosurgeon, and he specialises in skull-based surgeries for tumours such as the vestibular schwannoma, which is the pathology that we were interested in for this phantom in particular. The vestibular schwannoma is a benign tumour, so it's non-cancerous, and it arises from one of the nerves that connect the inner ear to the brain. And you can see an example of that in this image here. The tumour can be removed with neurosurgery via a craniotomy, which is where they cut a hole in the skull, kind of behind where the ear is. And then they can go in through that hole to remove the tumour. And in current clinical practice, intraoperative ultrasound isn't used for this surgery. But Dr. Shapey explained that it would be really beneficial to bring it into the operating theatre. But as the clinicians at the moment aren't familiar really with that technique, the phantom was needed as a clinical training tool. And also we needed a phantom for testing and validating a new neuronavigational system that Dr. Shapey's working on for this specific tumour operation. And finally, the phantom could be used for surgical planning, but that's not something that we investigated in this specific study. So the phantom had certain requirements that it needed to fulfill in order to be useful for those applications. Firstly, it needed to be created using real patient data so that it would be anatomically realistic. It needed to include a skull, a solid skull, with a craniotomy in the hole so that the surgery could be simulated. It needed to have the soft tissue structures that were important, made from tissue mimicking materials. That included the hemispheres of the brain and the cerebellum, which is in the base of the brain. And then the tumour needed to be included, and that had to be attached to the cerebellum, just as it is in the real patient. And the tumour would be approximately here, obviously depending on individual patients. And the phantom needed to have realistic imaging properties, including ultrasound for the intraoperative ultrasound, and also CT, because CT is what's used at the moment. Then it needed to have appropriate mechanical properties so that it could be manipulated in the same way that the brain is during surgery. And the phantom needed to be able to withstand the force from the ultrasound probe. So for the intraoperative ultrasound, a burr hole probe is used, which is a long, thin probe that can go in through the hole made from the craniotomy and make contact with the brain tissue. And whilst this isn't a really kind of high pressure or anything, the phantom still needed to be strong enough to withstand that force without breaking. Then finally, the phantom needed to be durable so that it could be used multiple times and stored for weeks or months in between uses. So bearing all of those requirements in mind, I decided to create a skull just by 3D printing it in solid plastic. We used PLA. And then I created the brain and cerebellum, the soft tissue structures, using polyvinyl alcohol, or PVA. And I chose that as the tissue mimicking material because it's well characterized in the literature as being an appropriate tissue mimic. And it has some useful characteristics such as the acoustic and mechanical properties of the material can be tuned by varying the freeze-thaw cycles that the PVA has to undergo in the fabrication process. And just in general, it's quite a sturdy, good tissue mimic. I'm now going to talk you through the fabrication process that we developed to create this phantom. We started with the pre-operative patient scans, including the MRI in A and the CT in B. And we used those scans to segment and get the regions that we were interested in. So we segmented out the skull, the two brain hemispheres, the cerebellum and the tumour, using 3D Slicer. And then once we had those segmentations, we used them to create models of the individual parts in Mesh Mixer. And we also had to manually cut the craniotomy hole because we'd used the pre-operative patient scan, so the craniotomy hadn't been done in there. And you can see the hole in figure B, hopefully. There's a little asterisk that marks where the hole's been cut. And then using those models, we went and created some molds. We did that in Fusion 360. So then we could 3D print the molds and use them for casting tissue mimicking material in. And here is one of the printed molds after it's been finished. This is the mold for the cerebellum. And the cerebellum mold was one of the hardest ones to create because we had to try and get all of the cuts in the mold in the right place so that the cerebellum could be removed at the end of the fabrication process without damaging any of the parts. And we also needed to be able to include the tumour so that that would be part of the cerebellum. We got some good results using the fabrication method. Here is a picture of the finished phantom. And in A, you can see the 3D printed skull, as I said, in PLA. In B, you can see one of the brain hemispheres made of PVA. And then in C is the PVA cerebellum and the tumour, which is marked by the asterisk. And hopefully you can make that out. The tumour is a slightly different colour to the rest of the cerebellum because it had to have different additives added to it so that the imaging properties of the tumour would be the same as they are in the patient, which is obviously different from the healthy surrounding tissue. And we imaged the phantom when we finished, so comparing it to the patient scans, we have the patient CT and then at the top, and then you can see the CT from the phantom underneath, and the tumour was really clear on the CT image, which was great. The skull we printed in not in 100% infill, just to save some time and because it didn't need it to be completely solid for this application. So that's why the skull and the CT looks kind of meshed and a bit funny, but that was fine for this application. And then on the right hand side, you can see at the top the patient ultrasound with the asterisk marking the tumour area and the diamond at the bottom highlighting some healthy tissue. And the phantom ultrasound image at the bottom you can see as well. And again, it was really easy to find the tumour with the ultrasound. That's what the asterisk marks there. And then there's also some healthy tissue surrounding it. So we were really happy with these results, and Dr. Shapey was able to use the phantom for testing his neuronavigation system in the virtual operating theatre. I published this work at the beginning of the year in Jove, the Journal of Visualized Experiments. And of course, because of Corona, the filming for the video got delayed, but we managed to film the video recently, and so hopefully that will be up early in the new year for anyone who's interested in more details of the fabrication process. Thank you very much for listening, and I'm happy to take any questions.